Majina yangu naitwa Hiv Maina. Niko na mke, nimeoa, niko na watoto 4, vijana 2 na wasichana 2. Ambapo mimi mwenyewe na mke wangu tunaishi na virusi vya ukimwi. Sisi wenyewe tumejikubali na huwa tunaendelea na matibabu vizuri. Sijawahi iona shida yoyote ambaye inatukumba katika maisha yetu, kwa kuwa sisi wenyewe tujikubali vile tulivyo. Mimi naambia mtu mambo ni mawili. Either umeze dawa ama ukufe. Kama unataka kuishi, meza madawa, utaishi. Kama mimi, simwambia ati kama mwingine, kama mimi vile mimi mwenyewe niko. Ukishajikubali tu, uoga ikutoke na ikutoke kabisa. Hakuna challenge yoyote ambaye utapata. Maisha iko kawaida kama vile wewe maisha yako iko wewe mwenyewe.
Thimas is among thousands of men, women and children living with HIV who have benefited from HIV care and treatment and are leading normal, productive lives. Kenya has made impressive progress towards controlling HIV. Today, there are fewer new infections and more people than ever before are receiving life-saving antiretroviral treatment. USAID's AIDS Population and Health Integrated Assistance Project, also known as APHIAplus Nuru Bonde, has been part of this success story. With support from USAID through the President's Emergency Plan for AIDS Relief, PEPFAR, APHIAplus Nuru Bonde project has since 2011 worked in partnership with the government of Kenya to combat HIV and mitigate its impact on individuals, households and communities.
APHIAplus project is a USAID funded project. It's a follow-on to APHIA 2 project. It was initially a 5-year project with a 2-year extension. It's a $98+ million program. It covers the counties of Nakuru, Baringo, Laikipia, Kajiado and Narok. Its goal is to mobilize communities to utilize services at health facilities and particularly HIV services. And it aims at achieving the outcomes of putting over 90% of those infected on treatment and ensuring that those who are on treatment actually achieve viral suppression to the extent possible. We are aiming at 90% of those who have been placed on treatment to achieve viral suppression rate.
HIV service delivery starts with knowing one's HIV status. With USAID support, APHIAplus Nuru Bonde helped to scale up HIV testing services to hundreds of sites and ensured that each health facility tested more people. The project trained and deployed counselors, ensured quality services, and helped to make test kits and other supplies readily available. Working with partners, APHIAplus Nuru Bonde project helped over 2.5 million people access HIV testing services in health facilities and through community outreach. Almost all clients who tested positive are now linked to care and treatment. APHIAplus Nuru Bonde project strengthened county teams and health facilities to improve quality HIV services by supporting training, facilitating community facility linkages, providing job aids and reporting tools. The project also helped to ensure efficient patient monitoring through laboratory testing and quality interaction with service providers. One of the biggest achievements of APHIAplus Nuru Bonde is the centralization of HIV care and treatment, which improved access and cut costs for over 53,000 HIV clients in the 5 counties the project supports.
In the early years of the start of the project, that is the 2011-2012, the focus was more on prevention, that is looking at the prevention activities, the social behavior change communication, moving out to the different populations, making sure that we arrest the infection right from the start. In terms of testing, it was generalized testing to reach all the clients and having all the clients started on treatment depending on the eligibility. By then, initially, it was a CD4 below 200, later moved to 350, and over time actually moved to 500, and currently we are on the test and start approach, whereby any patient who is identified positive is started on treatment immediately.
The number of facilities offering antiretroviral treatment not only increased from just over 100 in 2011 to almost 140 by the end of 2017. Patients who test HIV positive are referred to or escorted to the CCC, where they are further counseled and then enrolled for care and treatment. On registration at the CCC, patients are promptly started on antiretroviral treatment and regularly counseled on how they can adhere to medication. They also join support groups where they learn from other people living with HIV and are linked to various social services. The CCC at the Rift Valley Provincial Hospital, Nakuru County's premier referral facility, is one of the biggest in the region. The center serves over 8,400 patients, even after a large number switched to smaller facilities that started offering HIV services. The referral hospital has maintained quality services despite the big volume of clients, including children.
Now, when it comes to children under 5, they have been monitoring, and there have been a drastic improvement. There were tools that we were brought by our partners, whereby we could be able to see how many clients are being monitored. Initially, pediatrics, we noticed that it was not very good. But once the data was indicating that the monitoring was not very good, now they had a pedestal on which they were trying to reach. And with time, pediatrics has actually been able to overtake adults.
HIV clients are routinely monitored to assess how well they are responding to treatment. The most desirable health outcome for HIV patients is viral suppression, meaning that the amount of virus in their blood is too small to be measured and that they are unlikely to infect another person. This is a critical indicator of progress towards controlling the epidemic. APHIAplus Nuru Bonde has strengthened routine monitoring by training healthcare workers using viral load tests, facilitating transportation of samples from health facilities to laboratory hubs for viral load tests and the results back to clinicians to inform patient management. As Dr. Sam Muga explains, 8 in every 10 patients in health facilities supported by the project are virally suppressed.
The program has been able to do a total of 124,709 viral loads. These viral loads put the program as one of the best USAID supported partners in terms of performance. And also out of these viral loads, 99,407 were found to be suppressed, and 25,302 needed a review as not being suppressed. This gave an average suppression rate of about 80%.
Good nutrition is important for HIV medicines to work well and for the health of patients. APHIAplus Nuru Bonde helps to improve nutrition assessment and counseling services in HIV clinics as well as for vulnerable children and orphans. Nutritionists are now an important part of the healthcare team in the comprehensive care centers.
When one has a good nutritional status, it strengthens their immunity, making them less vulnerable to infections, slows down progress of HIV to AIDS, generally just improves the quality of life of a person because they're productive at all times, they're less ill, they're fit, and they can take on the world.
HIV-positive mothers can safely deliver babies free of the virus if they receive the right support, a big step towards eliminating new infections. APHIAplus Nuru Bonde helps to expand and improve the quality of prevention of mother-to-child transmission, ensuring that HIV-positive women are guided through safe conception, pregnancy, and delivery. Mentor mothers employed by the project and seconded to health facilities where they work alongside health care workers, mainly to assist HIV-positive pregnant women who want to have children. Mentor mothers are expert patients who have given birth to HIV-negative babies. They use their own experiences to advise other HIV-positive women on the journey to having babies free of HIV. As a result of the PMTCT interventions, 98% of babies born to HIV-positive mothers in facility APHIAplus Nuru Bonde supports are born free of HIV. All HIV patients are screened for tuberculosis and those infected are treated. Likewise, all TB patients are encouraged to know their HIV status. APHIAplus Nuru Bonde strengthened TB prevention, diagnosis and treatment through training and mentorship of healthcare workers in management of patients, rollout of gene expert diagnostic equipment, facilitating transportation of samples, improving recording of cases and ensuring availability of medicines and other supplies.
The TB sample processing by use of gene expert is done for all HIV clients, and samples are shipped to the respective hubs which have equipment placed, and the turnaround time is 2 days. This is a PCR technique, the gene expert technique, that is a molecular diagnostic test, which is more sensitive than the sputum AFB, the gold standard, which is the sputum AFB method.
APHIAplus Nuru Bonde project, supported by the county to ensure availability of HIV medicines and other commodities such as therapeutic foods for malnourished clients. The food is also provided through the Nutrition and Health Program Plus, another project supported by USAID and PEPFAR. Specific support included mentorship or managing inventories and improving forecasting of need by ordering sites to ensure timely requests for fresh supplies of nutrition commodities.
In the period of 5 years, the project has supported assessment, decentralization assessment, and newly established or upgraded ART sites are currently standing at 30. In the ordering sites, there are those satellites that were also established in the same period. That translates to 166 sites which were newly established. This has made it possible for our people to access ARVs and get continuous management of HIV and care.
While the project focused on HIV care and treatment, there were efforts to scale up availability of quality voluntary medical male circumcision, VMMC, which has been proven to reduce chances of HIV infection. APHIAplus Nuru Bonde helped to train health care workers, renovated facilities to offer VMMC services, provided surgical kits, and put in place measures to ensure quality. The project mobilized communities to seek free VMMC services at 3 main health facilities, several satellite clinics, and outreaches to sites such as schools and churches across Nakuru County.
We have already circumcised 25,009 males in the program. We also procured the disposable packs and also the surgical packs for the program. We have carried out quality monitoring, both internal and external monitoring for the services with the satisfaction. We have also identified and worked together, collaborated with the community leaders, the church leaders, and the schools and the politicians in the promotion of VMME services.
The project has set up help desks that link health facilities to communities. Commonly known as link desks, these service points are a vital connection that helps health workers in facilities to reach clients who interrupt treatment and understand how best to support community interventions for people living with HIV. When a client misses an appointment, health workers notify community volunteers through the link desk who trace them. In most cases, the clients return for treatment or request for transfers to health facilities they prefer. HIV affects not only the health of individuals, but other aspects of their lives and their families, including the welfare of children. Besides providing access to healthcare, APHIAplus Nuru Bonde also implemented activities to improve the quality of life for children in HIV-affected households and their caregivers.
Among the areas that we were covering were household economic strengthening, health and nutrition for the children and their households. We were also looking at sanitation and hygiene activities. We are looking at child protection activities. We are also supporting education activities and also looking at capacity building for the implementing partners that we work with.
To coordinate services provided to households, APHIAplus Nuru Bonde built the capacity of local partners and worked with them to set up drop-in centers within health facilities and community institutions. The drop-in centers are one-stop hubs staffed mainly by volunteers that link children and caregivers to different service providers.
APHIAplus imesaidia sana kwa kuwa wakati nilikuwa class 7, that is nikiwa primary, waliweza kunipatia uniform. Yeye alikuwa anavaa mango yenye mararu sana, kumeraruka sana. Walimu walikuwa na complain sana. Alikuwa anafukuzwa nyumbani sana kuzi. Hivyo uniform yangu ilikuwa inakaa vibaya. Kaweza kunipatia uniform. After that wakaniita tena wakanipatia mattresses, blanketi na nguo kadhaa hapo.
Like Peter, over 80% of the children that APHIAplus Nuru Bonde project helped to keep in school with USAID support transitioned from primary to high school. Many moved on to join colleges and universities. Older children from highly vulnerable families were sponsored to undertake vocational training courses, and some received startup kits to enable them start their own businesses. Many are now self-employed and helping to provide for families and see younger siblings through school. More than 23,000 heads of households with nearly 75,000 children benefited from USAID support to improve their livelihoods so that they can support themselves and children under their care. This assistance was provided directly to households and support groups. To sustain and promote local ownership of interventions benefiting vulnerable children and their families, APHIAplus worked with communities to form quality improvement teams. They comprise of local chiefs as well as representatives of caregivers, community organizations working with children, social workers, caregivers, agriculture extension workers, and young people. Their role is to identify critical problems facing households in the communities and jointly find solutions. Many of the groups started with efforts to encourage families to grow their own food.
Kulikuwa na agriculture teacher, alikuja akatutrain, akatuambia venye we can start it, how it can benefit us. APHIAplus ilinisaidia because venye nilijoin high school, you know, ukiuza hiyo mazao, at least ninapata shopping, ya pocket money. I don't need to stress my parents ati nataka shopping, nataka pocket money. Pana nilikuwa natoa hapo kwa family. Na pia part of school fees nilikuwa natoka hapo.
Quality data is critical to inform decision-making to improve HIV interventions at both community and facility levels. APHIAplus Nuru Bonde project improved data collection, analysis, and dissemination to measure progress and inform planning and service improvement.
One of our key achievements was putting in place reporting, data collection and reporting system for the OVC program. We were working with about 16 local implementing partners, and we were able to design a simple system for them to collect data. But above that, we had a very robust management information system we called OLMIS. And OLMIS allowed us to be able to improve on timely reporting for the partners, as well as complete reporting. Before we put OLMIS in place, we were at about 40% reporting rates for the implementing partners. But once we had the system in place, this increased to 95% for all the local implementing partners by the time we were closing the project. Now, the other achievement that we got through ALMIS was the ability to use the data from the system. The data was available, it was reliable, and through using that program data, we were able to do targeted testing, HIV testing for the orphans and vulnerable children. And at the point we put this system in place, we were at about 70%. By the time we were closing the project, we were at 99% of the OVC in our project had been tested for HIV. We built their skills to be able to analyze data, and one of the things they did very well was to build talking walls, and talking walls don't require a lot of resources for a local implementing partner to put in place. So the fact that they have the skills, this is something they can continue to do with any other programs that they implement. By the end of 2017, all the sub-counties were at 95% reporting rates. If we use PMTCT as a proxy report, and the national target is 95%. So we would say we were able to bring that reporting rate to the national standard.
Indeed, the project has made a very significant contribution in the fight to end HIV, not only by improving people's lives, but also by building local capacity to implement effective and sustainable health programs.
My greatest moment has been our HIV services have been focused on as a center of excellence. And this is from the number of visitors who come and learn, not only from outside, but also NASCOP brings them here to be able to come and learn from what we do.
Initially, including up to the county level, they used to see these as partner-supported services. And as at now, both at county level and sub-county level, the MOH has actually owned up the services. They take lead in planning, they take lead in supervision, they are advocating even within the devolved systems to make sure that the county government are also prioritizing HIV services and not seeing them as donor funded. They're saying these are our population and we have to protect them. So one thing I'm proud of is that they've actually owned, and with this there's going to be sustainability.
Initially, patients wished to move away, for example, because of the charges of some tests like the CD4 and the viral load. They would not get their results on time. But now, today they would wish to remain here. Despite moving from far, moving from this area, they want to maintain their clinic here. Why? Because of the services they get and even the quality care that they get. We are seeing our clients live a more healthy life, a more productive life, and we are encouraged. By the end of the day, you feel you have achieved in the help of APHIAplus.
If I look at maybe some figures, look at HIV prevalence, for example. Back in 2011, it was around 7 point something or 8% prevalence. Now we are talking about 5% prevalence rate for this based on the previous surveys. So to us, that is a small measure of a bigger engagement that you've had with the APHIAplus Nuru Bonde. Look at mother-child transmission of HIV. Around that time, Narok was among the leading counties in terms of mother-child transmission, PMTCT, and around 14%. But now we are probably talking about less than 8% mother-child transmission. That's a big achievement. We're no longer in the list of shame.
And our reporting rate, I think, over the times have actually gone up, not just in the key result area, but overall. So this is something we really say is a plus. From the days when we were province, we had very low reporting rates, but currently, really, they are quite high. The program has also been very key to support this CHMT in terms of support supervision, in terms of actually also being able to also leverage to the sub-county and the hospitals, because with the resources down there and if there's no leadership and governance, sometimes you find that things might not work. And so the program was able to a big extent to be able to support the CHMT. We had a partner who would go, you set your agenda, they come and pick on your agenda. So that in terms of if the partner would exit, you still run your show. They did not come and replace them. They rolled into the existing structures. Yes, so they come and support you to implement your agenda. And I think that's very critical.
I would like to take this opportunity to thank, on behalf of FHI 360, all the government partners, the county officials, the national level officials who worked with us to be able to deliver this program. I would also like to thank all the FHI staff for their tremendous effort in making sure that we delivered a technical program that really met the needs of the communities. I would also like to thank the US government through USAID for granting us the funds to be able to do this work. Indeed, the last 7 years have been very, very rewarding, and we are leaving a legacy of communities whose capacity has been built. We are leaving a legacy of people living with HIV who have been empowered and are able to access care and treatment. We are leaving a legacy of highly qualified technical teams in the various counties, ministries of health, who are now able to continue providing the services based on the technical support that we provided.